Hi friends, welcome to Sahakari Race Plus. In this module, we will be learning about conjunctivitis and trachoma. So both are important topics. Trachoma is even more important. Let's start. So what do you mean by conjunctiva? It is a transparent membrane that covers your lids and the sclera. So a thin transparent membrane that lines the inner surface of the eyelids and the anterior part of the sclera. Remember, conjunctiva, see, that cornea ne cover cheyyunnilla. Conjunctiva covers this part, okay, the anterior part of the sclera, and nammada eyelids when we evert up and down. So that area is also covered by conjunctiva. So what are the parts of conjunctiva? Look here guys. Look at this picture. This idana eyelids. This white area is sclera. Okay, this is the cornea. Everybody knows that. So the conjunctiva lining the eyelids, this part, okay, that is called as palpebral conjunctiva. Okay, palpebral conjunctiva. Look here also. So this part is called as the palpebral conjunctiva. And then you can see a fold here. That fold on the area, this area. This is called as fornix. Fornix. Okay, and that folding of the conjunctiva continues over the sclera, this part, it continues over the sclera. That is called as bulbar conjunctiva. So, let's get the concept orientation clear. Upper eyelids in the conjunctiva, conjunctiva upper and lower eyelids inner lining, that is called as palpebral conjunctiva, and then it forms a fold, okay, that is called as fornix, and then it continues over the sclera, that is called as a bulbar conjunctiva. So three parts of the conjunctiva you know. Now the question they ask you from conjunctiva is, what is the epithelium? Which kind of epithelium is there in conjunctiva? Conjunctiva has got layers, okay? Okay, before that, look here guys. This is a simple picture. For eyelids in avadeyulla conjunctiva ene njan endu vilikkunnu palpebral conjunctiva ennu vilikkunnu. Adineshesham oru fold undavunu adine fornix ennu parayunnu, and then it continues over the sclera, adine njan bulbar conjunctiva ennu vilikkunnu. Cornea ede mandeyil namukku conjunctiva undo? Illa. Cornea has got corneal epithelium. Okay, not conjunctiva. Okay, now the question they ask, see these are the layers of conjunctiva. Conjunctiva layers are itre. The question they ask is, what is the epithelium of conjunctiva? You can see the upper layer. Okay, so they ask which epithelium is there in conjunctiva. So the answer is non-keratinized stratified squamous epithelium. Please take a note of this. Karanam, this is your PYQ. Okay, the epithelium of conjunctiva is non-keratinized stratified squamous epithelium. Now we'll move towards different kinds of conjunctivitis. Bacterial conjunctivitis, viral conjunctivitis, hemorrhagic conjunctivitis, and so on. So what is this? Yeah, even before it comes on the screen, you should be able to see. You can see mucopurulent discharge here, matting of the eyelashes here. What kind of conjunctivitis it is? This is bacterial conjunctivitis, okay? So, if there is inflammation of the conjunctiva because of a bacterial cause, that is called as bacterial conjunctivitis. Usually self-limiting aana. It's contagious, means if somebody has bacterial conjunctivitis, this person has bacterial conjunctivitis, and then he gives you a shake hand. Okay, so what happens when you give him shake hand and then you touch your eyes, that bacteria is going to get inside your body, inside your eyes. So it's contagious. Okay. Now, the most common cause of acute bacterial conjunctivitis, it is Staphylococcus aureus. It is a simple question. This is a PYQ also. Most common cause of bacterial conjunctivitis endana Staph aureus aanu. Then other causes are there like strep, Haemophilus influenza. Now, okay, so that's all about bacterial conjunctivitis. What is this? Which kind of conjunctivitis it is? You can see preauricular lymphadenopathy. Chevida thottu munnile, you can see the lymph node has swollen. You can see the eyes which look reddish here. So, this is a case of viral conjunctivitis. Viral conjunctivitis, the patient is going to have a watery discharge. What is it? Watery discharge. Whereas bacterial, that yellowish mucopurulent discharge. Bacterial conjunctivitis. Viral conjunctivitis, the patient is going to have watery eye discharge. Second, mostly viral angle, they will give you history of upper respiratory tract infection. And Chevida frendilla, sometimes you can spot an enlarged lymph node. Okay. Now, basically, why this happens in viral conjunctivitis, why this lymph node gets swollen? Because the lymphatics from the conjunctiva, they drain towards the preauricular lymph nodes. Okay. So, our lymphatic vessel cell, if virus is there, the body starts to react, starts fighting against it. And as a reaction, the immune system, it will send its cells, okay, to fight the viral particles. Okay. So, there is a reaction occurring in the lymph node. That is why it looks enlarged. So, okay. So, clinical feature of any conjunctivitis, there is going to be redness, discharge, itching, watering. Okay. Epiphora means watering. Now, itching mostly, if it is too severe, we can see it in allergic conjunctivitis. Now, what is this, guys? We have now pseudomembranous conjunctivitis and membranous conjunctivitis. Okay. So, pseudomembranous conjunctivitis means here, because of a bacterial infection, allengil a viral infection, allengil chemical burns karanam on the eye, okay, an inflammatory reaction occurs on the conjunctiva and a pseudomembrane is formed on the conjunctival surface. So, see, pseudomembrane means what, when you try to remove that membrane, it is a false membrane. When you try to remove that membrane from the eyes, there will be no bleeding. Okay. നിങ്ങൾ ആ membrane remove ചെയ്യുമ്പോൾ bleeding ഉണ്ടെങ്കിൽ അതൊരു true membrane എന്ന് വിളിക്കും. ഇവിടെ pseudomembranous conjunctivitis, when you try to remove the membrane formed, minimal bleeding ആയിരിക്കും അല്ലെങ്കിൽ no bleeding ആയിരിക്കും when you remove the membrane. Okay. So that is the difference between a true membrane and pseudomembrane. Now, see why it happens? Why, suppose, let us say, kannil oru bacterial infection undai. Okay. Why there should be, so bacteria has come, okay, and has infected the eye. Okay. Not all bacteria, some. Sometimes it can lead to pseudomembrane formation because, see, whenever there is infection of the eye, it can lead to inflammation of the conjunctiva. Inflammation of the conjunctiva. Now, inflammation nadakumbo, the blood vessels, tiny blood vessels there, they become leaky. They become what? Leaky. Okay. And from these blood vessels, leaky blood vessels, fluid, plasma proteins, they start to leak out. Now, in plasma proteins, there is one protein called as fibrinogen. This fibrinogen gets converted to fibrin. If fibrin, along with inflammatory cells, debris, they will form a membrane on the conjunctiva. That is pseudomembrane. So basically the same pathology goes with membranous conjunctivitis also. Or inflammation, mucous membrane, conjunctiva, ആ ഇൻഫ്ലമേഷൻ ഉള്ള സ്ഥലത്തെ ബ്ലഡ് വെസൽസ് they become leaky. അവിടുന്ന് ഫ്ലൂയിഡ് പ്ലാസ്മ പ്രോട്ടീൻസ് they start leaking out. Okay. പ്ലാസ്മ പ്രോട്ടീൻസിൽ ഒരു ഫൈബ്രിനോഷൻ എന്ന് പറഞ്ഞൊരു പ്രോട്ടീൻ ഉണ്ട്. ദാറ്റ് ഗെറ്റ്സ് കൺവേർട്ടഡ് ടു ഫൈബ്രിൻ. ഈ ഫൈബ്രിനും അവിടുത്തെ ഈ ഏരിയയിലെ ഡെബ്രിസും ഇൻഫ്ലമേറ്ററി സെൽസും എല്ലാം കൂടെ ചേർന്നൊരു മെംബ്രെയിൻ ഉണ്ടാവുന്നു. അതാണ് സ്യൂഡോ മെംബ്രെയിൻ. ഓക്കെ. So what are the causes of pseudomembranous conjunctivitis? This is important. Diphtheria is one cause of pseudomembranous conjunctivitis. പക്ഷേ diphtheria can cause both. നമ്മൾ ഇനി അടുത്ത് പഠിക്കാൻ പോകുന്ന membranous conjunctivitis ആണ്. അപ്പോൾ diphtheria can cause both membranous and pseudomembranous conjunctivitis. Okay. Remember, this has come. Diphtheria membranous അല്ലെങ്കിൽ diphtheria pseudomembranous conjunctivitis മാത്രമല്ല cause ചെയ്യുന്നത്. It can cause both. And other organisms like Streptococcus pyogenes. Moving on. Viral causes. Severe adenoviral infection can cause pseudomembranous conjunctivitis. Moving on to membranous conjunctivitis. Same thing. Because of infection, a true membrane. A membrane is formed over the conjunctiva. ഇവിടെ വ്യത്യാസം എന്ന് പറഞ്ഞാൽ നമ്മൾ ആ മെംബ്രെയിൻ റിമൂവ് ചെയ്യാൻ നോക്കുമ്പോൾ it will bleed on peeling. It will bleed on peeling. That is why I call it as a true അല്ലെങ്കിൽ membranous conjunctivitis. Okay. Etiology, I told you same. Corynebacterium diphtheria. ഇവിടെ this has come as a question. Membranous conjunctivitis ന്റെ ട്രീറ്റ്മെന്റ് എന്താണ് എന്ന് ചോദിച്ചിട്ടുണ്ട്. അപ്പോൾ ഇവിടെ കോസറ്റീവ് ഏജന്റ് ആരാണ്? ഡിഫ്തീരിയ. അപ്പോൾ ട്രീറ്റ്മെന്റ് എന്തായിരിക്കും? The specific therapy is ADS. What is that? Anti-diphtheria serum along with systemic antibiotics. So this is important. അപ്പോൾ membranous conjunctivitis, the most common causes Corynebacterium diphtheriae. ഇത് നിങ്ങൾ ഓർത്തിരുന്നാലേ അതിന്റെ ട്രീറ്റ്മെന്റ് ഓർത്തിരിക്കുള്ളൂ. എന്താണ്? Anti-diphtheria serum. This is important. Okay. It has been asked before. Important. Now what is this? You can see a beautiful eye here, but our eyes in the ankles, you can see congestion, you can see moist or macerated skin. What I am talking about here is angular conjunctivitis. Basically, ankle, see. The mookane, nose. അപ്പോൾ ഇതിനെ ഈ ഒരു ആംഗിളിനെ ഞാൻ എന്ത് വിളിക്കുന്നു? ഇന്നർ ക്യാന്തസ് എന്ന് വിളിക്കുന്നു അല്ലേ? ഈ ഒരു ആംഗിളിനെ. ഓക്കെ. ഈ ഒരു ആംഗിളിനെ ഞാൻ എന്ത് വിളിക്കുന്നു? ഔട്ടർ ക്യാന്തസ് എന്ന് വിളിക്കുന്നു. അതിൻ്റെ പ്ലൂറലാണ് ക്യാന്തൈ. സോ ഇൻ ആംഗുലർ കൺജങ്ക്റ്റിവൈറ്റിസ് the ankles get infected. Okay. The skin near the ankle is infected. So, what is angular conjunctivitis? Read here now. Chronic conjunctivitis basically affecting the ankles of the eye along with excoriation of the nearby skin. Excoriation or moist, macerated out skin. Okay. Etiology is important. This is a question. What is the etiology of angular conjunctivitis? Please read it. Moraxella lacunata, acid field and Staph aureus. For this has been asked multiple times. Important. Moving on. What is the treatment? You give them antibiotic, eye drops and zinc oxide solution. Let me just erase it. Okay. So, zinc oxide solution along with antibiotic eye drops we give. Why do we give zinc oxide here in angular conjunctivitis? Because zinc oxide, see, look here before that. In Moraxella lacunata, because of this organism, there is going to be discharge in the eye. Kannile discharge ഉണ്ടാവും. ഈ ഡിസ്ചാർജ് പേഷ്യൻ്റ് കണ്ണിങ്ങനെ ബ്ലിങ്ക് ചെയ്യുമ്പോൾ ഡിസ്ചാർജ് ഗെറ്റ്സ് പൈൽഡ് അപ്പ് നിയർ ദി ആങ്കിൾസ് ഓഫ് ദി ഐ. ഓക്കെ. ആൻഡ് ഈ ഡിസ്ചാർജ് വളരെ തിക്കായിരിക്കും. ഓക്കെ. ആൻഡ് ഇറ്റ് വിൽ മേക്ക് ദ സ്കിൻ മോയിസ്റ്റ്. സ്കിൻ അറ്റ് ദി ആങ്കിൾസ് മോയിസ്റ്റ് ആക്കും. അപ്പോൾ ഇവിടെ ആ ഓർഗാനിസത്തിന് മൾട്ടിപ്ലൈ ചെയ്യാൻ വളരെ എളുപ്പമാണ്. ഇഫ് ദ സ്കിൻ ഇസ് മോയിസ്റ്റ്, ദ ഓർഗാനിസം ഇസ് മോർ ഹാപ്പി ടു മൾട്ടിപ്ലൈ. ഓക്കെ. അപ്പോൾ സിങ്ക് ഓക്സൈഡ് നമ്മൾ കൊടുക്കുന്നത് എന്തിനാന്ന് വെച്ചാൽ ഈ zinc oxide, it dries up it dries up the discharge. അപ്പോൾ ഈ ഡിസ്ചാർജ് ഡ്രൈഡ് അപ്പ് ആവുകയാണെങ്കിൽ ആ സ്കിൻ ഇത്രയും മാസറേറ്റഡ് അല്ലെങ്കിൽ മോയിസ്റ്റ് ആവുമോ? ഇല്ല. So in that case, the organism cannot multiply. Okay, so this is actually helping us. It's actually not letting the bacteria grow. Okay, it dries up the discharge, makes the skin all right, so the bacteria cannot multiply here. Understood? That's important. Zinc oxide and angular conjunctivitis. All right. Okay, that's a reason F. What is this? Yeah, this is a picture. This is very important. Image-based question. This is hemorrhagic conjunctivitis. So because of certain organisms, mostly viral, our conjunctiva, tiny blood vessels, they tear. Okay, and it gives a very reddish, scary look. This is called as hemorrhagic conjunctivitis. The causative organism. So all the causative organisms they have asked either in your NEET PG or NICT. Please mug it up. Most important, enterovirus 70 has been asked before. These also have been asked. So enterovirus 70, at least that you should remember, that causes hemorrhagic conjunctivitis. Okay, along with adenovirus coxsackie and ecovirus 34. What is this condition, guys? This is a case of very important picture, image-based question, trachoma. This is a picture of trachoma. Now, what is that? Trachoma, first point. What is it? It is a chronic eye infection. Second point. Why does it occur? Because of which organism, which bacteria? Chlamydia trachomatis. Where is it usually seen? വൃത്തി കുറവുള്ള സ്ഥലത്താണ് നമ്മളിത് കാണുക. Poor hygienic conditions, people are prone to get this. Okay. And we'll talk about the features of trachoma. First point in trachoma, that is, it is a chronic eye infection. First point. Second point, why does it infection occur? It occurs because of the bacteria Chlamydia trachomatis. And predisposing factors എന്താണ്? വൃത്തിയില്ലാത്ത സ്ഥലങ്ങളിലാണ് നമ്മളിത് കാണുക. Poor hygienic settings. We'll talk about the features of trachoma. Okay, ഈ trachoma because of changes happening on the cornea, on the conjunctiva cornea, patient can even get blindness if untreated. So trachoma is very important condition. നമ്മൾ കറക്റ്റ് സമയത്തിന് ട്രീറ്റ്മെന്റ് കൊടുത്തില്ലെങ്കിൽ he can land up in being blind. So it is a leading cause of preventable blindness worldwide. Important point. So why does it occur? I told you Chlamydia trachomatis. It is a bacterium, but it shows both the properties of bacterium and virus. Okay. ഒരു obligate intracellular parasite ആണ്, meaning it can live and multiply only inside a cell. That is a meaning when I say obligate intracellular parasite. You know, when you learn micro, again micro, patho, wonderful subjects. You'll be learning about this in micro. What are the serotypes of chlamydia? See, trachoma undakunathu, the strains of chlamydia, trachoma undakunathu A, B and C. Important. D to K strains or serotypes, they cause genital infections. L1, L2, L3. These strains or serotypes of chlamydia, they can cause genital infection called as lymphogranuloma venereum. What is lymphogranuloma venereum, guys? There is sexually transmitted disease occurring because of chlamydia. Okay. And the patient presents with painless genital ulcers which can progress to buboes. What do you mean by buboes? Buboes means enlarged inguinal or femoral lymph nodes. അപ്പോൾ ഈ ഒരു ഇൻഫെക്ഷൻ കാരണം ഈ ഇൻഫെക്ഷൻ LGV, lymphogranuloma venereum, അത് പ്രോഗ്രസ് ചെയ്യുവാണെങ്കിൽ ഇറ്റ് ക്യാൻ ബിക്കം buboes. Buboes എന്താണ്? പെയിൻഫുൾ എൻലാർജ്മെന്റ് ഓഫ് ദി ഇൻഗ്വൈനൽ അല്ലെങ്കിൽ ഫീമറൽ ലിംഫ് നോഡ്സ് ആണ്. ഓക്കെ. ആൻഡ് കോംപ്ലിക്കേഷൻസ് ഓഫ് ദിസ് കണ്ടീഷൻ, If we don't treat it, the genital ulcers, they can undergo fibrosis, strictures in genitals or rectum. Now, how does trachoma spread? Okay, we're coming back to the eye. Trachoma spread ചെയ്യുന്നത്, it is from flies. Okay, this infection can be transmitted by flies. If a person is infected, okay, he touches his eyes and then he touches you, okay, and your hands get infected, you touch your eyes again, this infection can come to you. Fomites, such as shared objects, towels, handkerchiefs. ഇതൊക്കെ ട്രാക്കോമ ഉള്ള ഒരു പേഷ്യൻറ്റിന്, ഇതൊക്കെ ട്രാക്കോമ ഉള്ള ഒരാളിൽ നിന്ന് നിങ്ങൾ ഷെയർ ചെയ്യുകയാണെങ്കിൽ you get that. Fomites means objects, okay, and close contact in poor hygiene settings. So trachoma, we have got early stages, we have got late stages. Early stages over the palpebral conjunctiva, you can see grain-like appearance. Grain-like appearance. ഇത് കണ്ടോ? ഈ ഗ്രെയിൻസിനെയാണ് നമ്മൾ സാഗോ ഗ്രെയിൻസ് എന്ന് പറയാം. അപ്പോൾ early stages of trachoma, you can see sago grain-like appearance on the palpebral conjunctiva. Next, papillary hypertrophy. Okay. So see, look here. So all of these, endondana sago grain appearance, papillary hypertrophy, whatever I'm saying, all this happens because of the immune response. Whenever an infection kannil undavumbo, the immunity acts against the infection. So this reaction, this fight between the immune cells and the bacteria can cause changes in the eye. Adana ee features ella undakunnathu. Appo papillary hypertrophy undagunu. എന്താണ് പാപ്പിലെ? നമ്മുടെ upper palpebral conjunctiva നമുക്ക് പാപ്പിലെ ഉണ്ട്. What is papillae? We have discussed it. It is basically core of the tiny blood vessels. ഈ upper palpebral conjunctiva tiny blood vessels ന്റെ കോറിനെയാണ് നമ്മൾ പാപ്പിലെ എന്ന് പറയാം. Okay. Now, so the next feature that you see in trachoma is papillary hypertrophy. So what are papillae, guys? Papillae, നമ്മുടെ palpebral conjunctiva, what do we have? We have got tiny blood vessels. ഈ tiny blood vessels ന്റെ കോറിനെയാണ് ഞാൻ papillae എന്ന് പറയാം. Okay. So because of inflammation occurring here, they are going to undergo hypertrophy. So you can see these papillary hypertrophy in trachoma. Second, pannus. What is pannus? See, look here. This is a cornea. Limbus kandile. Limbus inde chuttinum you can see blood vessels being formed. About superficial vascularization of the cornea, that's called as pannus, that's seen in trachoma. I told you, in trachoma, the conjunctiva, okay, conjunctiva എന്തുണ്ടാവുന്നു? ഇൻഫ്ലമേഷൻ ഉണ്ടാവുന്നു. കൺജങ്ക്ടൈവയിൽ എന്തുണ്ടാവുന്നു? ട്രാക്കോമയിൽ ഇൻഫ്ലമേഷൻ ഉണ്ടാകുന്നു. ഓക്കെ, ഇത്രയും മനസ്സിലായി. അപ്പോൾ ഓവർ ടൈം ഇൻഫ്ലമേഷൻ ഓഫ് ദി കൺജങ്ക്ടൈവ can make it, contracted. Okay, can make it contracted. അപ്പോൾ ഈ contracted conjunctiva, because of chronic inflammation, conjunctiva becomes slightly contracted and this part of the conjunctiva will come near the cornea. Okay, and of course as a response to chronic inflammation, scar formation ഉണ്ടാകും conjunctiva. നമ്മുടെ ബോഡിയിൽ എവിടെ സ്കാർ ഉണ്ടെങ്കിലും the body will try to form new blood vessels around it. Okay, that is normal. എവിടെ സ്കാർ ഫോർമേഷൻ ഉണ്ടെങ്കിലും നമ്മുടെ ബോഡി what does it do? It will try to form new blood vessels around it to make it normal. അപ്പോൾ ഇവിടെ ഞാൻ പറഞ്ഞു ട്രാക്കോമയിൽ കൺജങ്ക്ടൈവൽ ഇൻഫ്ലമേഷൻ ഉണ്ടാവുന്നു. ഓവർ ടൈം സ്കാറിംഗ് ഉണ്ടാകാം കൺജങ്ക്ടൈവയിൽ. Conjunctiva can become contracted and it can be pulled or it can come towards the cornea. അപ്പോൾ ഈ scarring of the conjunctiva, ആ ഏരിയയിൽ body, what does the body do? Okay, that area is not looking good. Let me give it some blood supply എന്ന് പറഞ്ഞിട്ട് അവിടെ blood vessel formation ഉണ്ടാകുന്നു. So that is why ഈ contracted conjunctiva അടുത്ത് new blood vessels are formed. പക്ഷേ your cornea does, see, nothing should disturb the cornea. So if vascularization occurs near the cornea, your vision is going to get affected, right? Okay. Now, Herbert Spitz, very pathognomic of trachoma. ഇവിടെ again, because of infection, okay, upper limb muscle, okay, upper limb muscle, you know what? To fight the infection, lymphocytes, lymphoid aggregates varum. Lymphoid aggregates varum. Okay? And they will form follicles. അതിനെയാണ് നമ്മൾ Herbert's follicles എന്ന് പറയുക. Okay? During the active stage of infection. Lymphoid aggregates will try to wipe away the infection, and you can see them at these lymphoid aggregates as follicles in the upper limbus. അതിനെയാണ് ഞാൻ എന്ത് വിളിക്കുന്നത്? Herbert's follicles എന്ന് വിളിക്കുന്നത്. So as trachoma progresses, okay, and once trachoma heals, ഈ lymphocytes, they will fade away. Okay. So എവിടെയായിരുന്നു Herbert's follicles ഉണ്ടായിരുന്നത്? ആ ഭാഗത്ത് you can see depressions. You know, once the trachoma heals, these lymphoid aggregates will go away. Okay, so these areas can be seen as depressions at the limbus. അതിനെയാണ് നമ്മൾ Herbert's pits എന്ന് വിളിക്കുക. It is also an image-based question. Okay, Herbert's pits. Where do you see it? In trachoma. Trachoma. Now see, guys. What is the first picture? ഇതെന്താ first picture? Entropion. What is it? Entropion, inward pulling of the eyelids. Entropion. Why? Same reason, conjunctiva, inflammation ഉണ്ടാവുന്നു conjunctiva. And over time, conjunctival scarring ഉണ്ടാവുന്നു, conjunctiva contracted ആവുന്നു. ഈ contracted ആവുന്ന സമയത്ത് നമ്മുടെ inner eyelidനെയും കൂടെ അത് അകത്തേക്ക് പുള്ള് ചെയ്യുന്നു. അതുകൊണ്ടാണ് entropion ഉണ്ടാകുന്നത്. Okay. And because of these changes, there could be eyelashes rubbing onto the cornea. You can see the second picture. What is it called as? Trichiasis. Okay, trichiasis. Now look here. In later stages. Okay, I'll talk about All's line. You can see entropion, trichiasis. And when something is irritating the cornea, cornea kore nera chenu irritate cheyani eyelashes. What happens? Corneal ulcer undava. Corneal opacity undavum. It can affect the vision finally, sometimes leading to blindness. Okay, and there is something called, this is important, All's line. It is a linear scar on the upper palpebral conjunctiva. Look here, look here. This, can you see this linear scar here? ഇതിനെയാണ് നമ്മൾ എന്ത് വിളിക്കുന്നത്? All's line. Okay, now we have a classification for trachoma. Important. നമ്മൾ ട്രാക്കോമനെ ക്ലാസിഫൈ ചെയ്തിരിക്കുന്നു in the name of fisto. But why do we need to classify trachoma? See, basically that is for surveillance, okay, and grading system. Okay, for treatment we have classified it. Fisto classification എന്നാണ് പറയുക. And the F stands for if the patient has got follicles, more than 5 follicles in the upper palpebral conjunctiva. I is for inflammation. If the patient has got scarring, then it is S. T for trichiasis, and O for opacity over the cornea. Now, HP bodies. HP bodies in the, what are HP bodies seen in trachoma? HP bodies are, first point, inclusion bodies ആണ്. എന്താണ്? Inclusion bodies. എന്താണ് inclusion bodies? നമ്മൾ പഠിച്ചിട്ടില്ലേ? Rabiesൽ we get to see negri bodies. അതും inclusion body ആണ്. See, ഒരു സെല്ലില് if a bacteria or virus enters, okay, bacteria or virus enters, ഈ infective organism അതിൻ്റെ byproducts, okay, അതിൻ്റെ metabolic products, അതിൻ്റെ pigments, okay, all of it can get aggregated either in the cytoplasm or in the nucleus of the cell that is infecting. ഒരു സെല്ലിനെ ഏതെങ്കിലും ഓർഗാനിസം ഇൻഫെക്റ്റ് ചെയ്യുമ്പോൾ ആ ഓർഗാനിസത്തിൻ്റെ മെറ്റാബോളിക് പ്രോഡക്ട്സ്, ഡെബ്രിസ്, പിഗ്മെന്റ്സ് ഇതെല്ലാം കൂടെ ആഗ്രിഗേറ്റ്സ് ഉണ്ടാക്കും ആ സെല്ലിനകത്ത്. ഓക്കെ, ഐദർ ഇൻ ദ സൈറ്റോപ്ലാസം ഓർ ഇൻ ദ ന്യൂക്ലിയസ്. ഓക്കെ, അപ്പോൾ സൈറ്റോപ്ലാസം അവിടെയാണ് നമുക്ക് ആ ഒരു അഗ്രിഗേറ്റ്സ് കാണുന്നതെങ്കിൽ ഞാൻ അതിനെ ഇൻട്രാസൈറ്റോപ്ലാസ്മിക് ഇൻക്ലൂഷൻ ബോഡീസ് എന്ന് വിളിക്കും. ന്യൂക്ലിയസിൻ്റെ അകത്താണ് എനിക്ക് ആ ബോഡീസ് കാണുന്നതെങ്കിൽ I call it as intranuclear inclusion bodies. Now, trachoma, because of this causative organism, conjunctival epithelial cells in agatha, we can see inclusion bodies and they are called as HP bodies. HP bodies. PYQ. Halberstader Provazic bodies. Intracytoplasmic inclusion bodies are. What is the treatment? Okay, this is, everybody knows the treatment, I'm sure. The treatment of trachoma, it is safe strategy. S here stands for surgery. Trichiasis ulla we go for surgery. A is for antibiotics, we can give oral azithromycin. F for facial cleanliness, okay? Keep the face clean, regular washing of the face to reduce the transmission. And E for environmental improvement, sanitation improve akka, control waste management, clean water. So that all comes under environmental improvement. So I hope you understood conjunctivitis and trachoma. Very important topics but very easy topics also. Let's do some questions. So pathognomic sign of healed trachoma, that is what? Herbert's pits. Herbert's pits. Okay. Inclusion bodies seen in trachoma, they are called as HP bodies. HP bodies. Angular conjunctivitis is commonly caused by all these are PYQs, okay, moraxella lacunatum. Now, one second guys. Actually, angular conjunctivitis, no, it is moraxella matralla. It's caused by Staph aureus also, okay. Which of the following is the most common causative agent for acute bacterial conjunctivitis? Acute bacterial conjunctivitis, we just learned it, Staph aureus. A key feature of membranous conjunctivitis is the formation of a true membrane. That membranous conjunctivitis, what happens? It will bleed on peeling. That is why it's called as a true membrane, right? Primary etiological agent for membranous conjunctivitis is, very good, D, Corynebacterium diphtheria. Angular conjunctivitis, which affects inner and outer canthi, it is caused by moraxella lacunata. Okay. Enterovirus 70, that's caused by, that causes which conjunctivitis? Hemorrhagic conjunctivitis, okay. In the treatment of angular conjunctivitis, function of zinc oxide andana, it will dry up the discharge and inhibit the bacterial growth. Enterovirus 70, Coxsackie 24, it causes what guys? Hemorrhagic conjunctivitis. Trachoma, chronic eye infection, and it is caused by which parasite? Chlamydia trachomatis. Which serotypes of chlamydia are responsible for causing trachoma? Important. ABC. ABC. LGV is associated with which serotypes of chlamydia? LGV, that is L1, L2, L3. Sago green follicles on the upper palpebral conjunctiva, they are features of what? Trachoma. Sago green follicles, trachoma. What are the pathognomic small greyish depressions at the limbus in the later stages of trachoma called as? Herbert's pits. In the psychiatrical stage of trachoma, linear scar on the upper tarsal conjunctiva is known as All's line. Inward turning of the eyelashes that rub against the cornea. What is it called as? Inward turning of the eyelashes. That is called as trichiasis. If the question is inward turning of the eyelid, that is entropion. In WHO Fisto classification, S in trachoma, S stands for scarring. HP bodies are inclusion bodies associated with Chlamydia trachomatis. Chlamydia trachomatis causes trachoma. For conjunctival epithelial cells, the inclusion bodies HP bodies. Very simple, right? The WHO endorsed safe strategy is for the control and treatment of which disease? That is safe strategy, trachoma. In safe strategy, what does the letter S represent? We just talked about it. Repeat question. S stands for surgery. I didn't spot the surgery. I'm just looking at it. It's B. What does the letter F in the SAFE strategy stand for? F, that is for facial cleanliness. Which oral antibiotic is recommended as a part of SAFE strategy for trachoma? It is azithro. Okay, azithromycin. Find out the statements that are true about trachoma. Okay. It is caused by chlamydia trachomatis, serotypes D to K? No. Trachoma, A the serotypes ana. A the serotypes of chlamydia causes trachoma, guys. A, B, C. So this is false. Okay. D to K causes genital infections. All's line is a linear scar on the upper tarsal conjunctiva seen in the later stages. Correct, LA? That is true. Herbert Spitz pathognomic follicles found in the lower palpebral conjunctiva. Is it? No. Herbert Spitz you see it on the upper part of the limbus, because that's wrong. It is a leading cause of preventable blindness worldwide. That is true. Okay. So we are choosing the true statements. So we have 2 and 4 which are true. Moving on. Find out the statements that are not true about membranous and pseudomembranous conjunctivitis. Okay. Corynebacterium diphtheria is a primary etiology for membranous conjunctivitis. True, right? True. When a pseudomembrane is peeled, it leaves a raw bleeding surface. Is it? No. Pseudomembrane, it doesn't do that. There is minimal bleeding when you take off the pseudomembrane. So that is false. Severe adenoviral infections are a known viral cause of pseudomembranous conjunctivitis. That is true. Diphtheria can only cause membranous conjunctivitis, not pseudomembranous conjunctivitis. No, that is wrong. Diphtheria can cause both membranous and pseudomembranous conjunctivitis. So this is false. Not true. False statements are that is 2 and 4. They are false. Okay. Find out the statements that are true about chlamydia trachomatis. Okay, a lot of questions on chlamydia trachomatis because that was a topic. It's an obligate intracellular parasite. Okay, very true. Right? Second, serotypes ABC. It causes LGB? No, ABC will cause what? Trachoma. So this is false. HP bodies, they are inclusion bodies seen in the epithelial cells in trachoma. That is true. That is true. Serotypes D to K are associated with genital infections, which is true. Appo inatha true aanu choichirikkunnathu, so that is 1, 3 and 4, right? Yeah. That's it with today's module. Hope you understood. Kindly give me the feedback. See you all in the next coming sessions. Stay blessed. Bye.